I was a figure skater back since I was 8 years old until about 17, and then I got into freestyle skiing. A lot of world championships, 88 Olympics, and then coached for Canada and the US ski team after that. I'm having a total hip replacement today. 7 or 8 years ago, I started to play tennis, and I started feeling that my back was really tight. I started feeling that I like to stretch in the morning a lot, and I couldn't stretch as much. I noticed bending down on one side. It was like there was I couldn't get down there. I noticed I got tired more. Nights the worst, laying in bed, and if I turn over and suddenly it's like, ah. It's a very dull, achy pain that something's stuck in there. I want to be able to not worry about, oh, I'm gonna go hike Mount Hood with my husband, am I gonna make it? I want to go play tennis, I can do it. I just want to be able to do these things.
We're at the Southwest Washington Regional Surgery Center, which is an 8-bed ambulatory surgical center in Vancouver, Washington. We do pretty much all types of surgery, from ENT to plastics to general surgery, and a lot of orthopedics and neurosurgery. I've known Jan for a couple of years now. She was starting to develop symptoms that were really consistent with arthritis. And not too surprisingly, as she came back, every time she came back, her pain was a little worse, she was doing a little less, and it was starting to affect her activities of daily living. When I last talked to her in the office, it was evident that the straw had broken the camel's back and she was ready to consider a joint replacement. So when we talk about total joint replacement, what we're talking about is the replacement of a joint on all sides of the joint, typically a shoulder or a hip or a knee or an ankle. This is a high volume center, and we know that places that do high volumes typically have better outcomes and fewer complications than low volume centers. We've got a very well-trained group of surgeons that are interested in outpatient total joint surgery and are doing a lot of it. When I was a resident in the early 90s, we would tell patients to expect 10 years out of their components. Now what I tell my patients is we expect that 95% of people will be doing well at 15 years, and that probably we're expecting 85% of people to be doing well at 25 years. The techniques have improved, the components have improved markedly, but the part that goes into patients' recovery has really what's been the revolution, if you will. What used to be a 5 or 6 or 7 or 14 day in hospital is now same-day surgery. Patient education is clearly the most important part of this whole process. We have them come to an outpatient class. That way, the family's clear of what's going to happen, the patient's clear of what's going to happen, and the expectations that they have for us and importantly we have for them are really clear. What we know is that the more people are educated about their health care, the better it is.
There's an education class that is a requirement in order to go home the same day, along with having their coach, the primary person that's going to be helping them, attend that class. So we review information in the classroom. It includes therapy training, it includes preventing complications, medication management. The coach is there to support them, drive them to and from their appointments, help them keep track of medications. They're a huge part of making this recovery a success.
I'm here being coached for my wife. The class was really interesting and informative, made us feel really good about the procedure and explained everything.
So I'm just going to tell you a little bit about how things go today. I'll go right in to the operating room with you.
Everything I've heard, everybody I've talked to has raved about this place. The care, the staff, they are really on it.
I just make sure that they're comfortable with the surgery process and answer any questions that they might have. Everybody plays a special part in making this team the best. And the patients who have come through here for the joint program have been very, very happy with their care.
When you can tell that your nurse and your OR team and the scrub techs and your surgeon and the physician assistant and everybody that plays a role in this has you as the center of attention, wants to make sure you do well, address any concerns you have, that offers you as an individual who's going through major surgery reassurance.
We usually get them up sitting in a chair in the first 45 minutes to an hour, and most of them are walking within about 2 hours.
It's pretty amazing that soon after surgery to be up and walking. And the doctor came, said everything went well, and that when she would wake up, then they'd come and get me, which was surprisingly short period of time. From the class to the pre-op and post-op, it's a great team.
They really covered everything in the book and the seminar, and talking to Dr. Southerland, which is great. He comes in often. Everything you can do, I just want to make sure I hear him say it. I trust him. I think that's a big key too, is a trust issue.
When they get up and walk and for the first time they don't have any pain, it's life-changing. People are really grateful. And that's really rewarding. That's the most rewarding part of my job.
You know, first step, and she was like, wow, this is, you know, perfect. So it was great. I know she needed it, and I think it's going to improve the quality of life.
I feel pretty good. I still want to continue to ski, and also I play tennis and play lots of sports and used to windsurf and all sorts of fun things, so I really want to continue my activity. My goal is to get back without pain and better than I was before.